Ladies, listen up. If you have Crohn's disease or ulcerative colitis and are thinking about getting pregnant or are already pregnant, then you may be wondering if your pregnancy or future pregnancy could make your IBD worse, then this is the video for you. So stick around because I will tell you if pregnancy can make Crohn's disease or ulcerative colitis worse. Welcome back to my channel, the only place for Crohn's and colitis tips, tricks and information. So make sure you subscribe to my channel and hit the bell to be notified every time I post a video. And if you want to join an exclusive community of people who receive tips and tricks on living with Crohn's and colitis, make sure you sign up to my newsletter by visiting the link in the description box below. I know it seems a bit weird for a guy to talk about and give pregnancy advice, but the topic of pregnancy and fertility really interests and excites me. And some of you may not know this, but I've done a master's in reproductive medicine and worked in the pregnancy and fertility field for a few years before becoming a radiographer. But let's not waste time on that. But before we get into things, always remember it's important to discuss any concerns you have with your doctor and to have regular antenatal checkups to ensure you and your baby are doing well. So without any further ado, let's just get started. So the good news is, if you are in remission, which means your disease has effectively gone to sleep, then most women with Crohn's disease and ulcerative colitis will go on to have a normal pregnancy and a healthy baby, and that your IBD will or should hopefully stay in remission during your pregnancy. The only problem is when your Crohn's or colitis is active, or in other words, you're in a flare or experiencing symptoms. It's been suggested that if you conceive while your disease is still active and causing you problems, then you are more likely to give birth earlier than your due date, and that your baby will have a lower birth weight when compared to normal population. But this isn't always the case, as many have been pregnant with active disease and have had normal pregnancies and healthy babies. More research is needed to know the impact of pregnancy on both Crohn's disease and ulcerative colitis, but the signs do look promising, as some research suggests that pregnancy may be able to stabilize IBD, as pregnant women with IBD seem to have less flares and are less likely to need surgery after they've given birth. So that is a very short video on if pregnancy can make your IBD worse, and the simple answer is not really. So now make sure you check out these videos for more tips, tricks and information relating to Crohn's and colitis. And if you found it useful, hit that subscribe button and the bell to be notified every time I post a video, as well as leaving a like and a comment. And I can't wait to see you all for the next episode.